Good afternoon, everyone, and welcome to the Community Resilience on COVID-19 Lessons Learned Convening. This is sponsored by HealthWorks and Georgia CEAL, which is the Community Engaged Alliance Against COVID-19 Disparities. We are happy to have all of you all join us this afternoon. And so this convening brings together community-based and community-serving organizations across Georgia and several members of the Georgia CEAL Community Coalition Board. Here to share more information about Georgia CEAL and the Community Coalition Board, in addition to our partnerships, is Dr. Tabia Akintobi. Dr. Akintobi is Professor and Chair of Community Health and Preventive Medicine and Dean of the Community Engagement at Morehouse School of Medicine. And she also serves as a Principal Investigator of the Georgia Community Engaged Alliance Against COVID-19 Disparities. Dr. Akintobi, can you please enlighten us?
Thank you so much, Brittany, and thanks to all who've made the time to spend time learning about what we have learned through community-led leaders connected to the Georgia Community Engaged Alliance against COVID-19 disparities, and of course our latest collaboration together, which is HealthWorks. Georgia CEAL and HealthWorks bring together community leaders who were already doing important work through established journeys of trust and trustworthiness with priority communication community groups across the state of Georgia. And we know the pandemic has certainly continued to magnify the health issues that existed before, and the organizations that you'll see featured today represent important work that was happening long before the pandemic. And through the pandemic, their leadership, as well as lessons learned in navigating how to continue the work of effective community engagement, has been designed to make sure that people have what they need in the amount that they need it, to be educated about the pandemic, to develop action strategies in response, and to do what we are very clear on, and that is to promote vaccinations and meet people where they are at whatever point they are at in terms of their decision-making process. So we're thrilled to be able to advance the art and the science of effective community engagement through the organizations that have been funded. And we look forward to learning from them and amplifying our collective knowledge on what works, how, and for whom. That's just another way to describe what health equity is. Advancing the journey of giving people what they need in the amount that they need it to live out their optimal health. So I'm really excited today, excited about what we will all learn together on how we advance the path forward.
Absolutely. Thank you for sharing that, Dr. Akintobi. And so as Dr. Akintobi said, the HealthWorks Consortium was really created to empower building community resilience in small businesses and community-based organizations and community-serving organizations. And so as a part of the HealthWorks Consortium, Georgia CEAL offered some small grants across Georgia in different formats. So we're going to give you a chance to learn about these small grants and the organizations that are recipients of these small grants. They are serving in the form of panelists, and I'll introduce them now. So first we have Ms. Bella Borhe. She is Executive Director and Co-Vice Chairman of the Hispanic Health Coalition of Georgia, which is a nonprofit organization created to advance health policies that improve access to services for Hispanic, Latino children and adults in order to secure better health outcomes and prevent chronic diseases with increased sustainability throughout the state. Then we also have Dr. Abu Rayhan. He is the director of Shifa Clinic and possesses over 25 years of experience in large and complex program design management, strategy, and policy advocacy. Dr. Rayhan has also served as a board member of international and national development organizations, including the National Association of Free and Charitable Clinics. Next up, we have Mr. Daryl Sobbs, who is the Community Benefits Manager for Phoebe Putney Health System, and he is representing Sobbs and Associates. He currently serves as a Community Benefits Manager, and he works with the hospital, identifying ways to impact community health with particular focus on the underserved. He has been doing this work for over 4 decades in Southwest Georgia. Then we have Dr. Arthur Vaughn of 100 Black Men of North Metro Atlanta. Dr. Vaughn is a native New Yorker who has called Cobb County, Georgia home since 1995. And in serving as a chairman, he has been a member of 100 Black Men of America on the National Health and Wellness Committee. And over the last 16 years, he has served in a senior leader position in higher institutions of education, such as Morehouse School of Medicine and Southern Polytech State University, which is now Kennesaw State University, excuse me. So next we have Dr. Michael Armstrong. Dr. Armstrong is the Chief Operating Officer for the Georgia Campaign for Adolescent Power and Potential, also known as GCAP. There he leads a remarkable team of public health program evaluation, health communications, and youth development leaders. He's a community psychologist with over 25 years of experience in nonprofit leadership, applied research, adolescent development, public health, and community development. Next, we have Dr. Ike Mack. He is the president of Fellowship Missionary Baptist Convention of Georgia. He serves also as a pastor of Unionville Missionary Baptist Church and has been doing so for the past 36 years. In addition, as he's a very busy man, Dr. Mack is a president for the board of directors of the Macon-Bibb Economic Opportunity Council Incorporated. And most recently, Dr. Mack has had a lovely street named after him down in Macon, Georgia. Next up, we have Mr. Semisola Oyuder. He is a research associate, for Georgia Arrhythmia Consultants and Research Institute. He has been working for nearly 10 years in the industry of sponsored research in the fields of cardiology, cardiac electrophysiology, and musculoskeletal biomechanics. And last, but certainly not least, we have Mr. Gaurav Kumar, who serves as the president of the Andrew J. Young Foundation. Mr. Kumar has 20 years of experience in the profit and nonprofit sector, serving in technical and leadership roles. At the foundation, he works with Ambassador Young to incubate new ideas and technologies on feeding the hungry, healing the sick, and also has spearheaded social innovations to fight malnutrition and provide food security worldwide, focusing on aquaponics farms and extraction of organic vegetable protein and amino acids. So this is our panel. This is also representing the small grants that were provided as a part of the HealthWorks Consortium. So next we are going to take a look at what caused Georgia CEAL, or what allowed Georgia CEAL to offer these small grants across Georgia in different communities. That led to, of course, us feeling an urgency in closing the vaccination gap and empowering community-based organizations to do this work and to continue doing this work once these grant opportunities end. So as of November 29th, 13,390 people were hospitalized for COVID-19 in the United States, which is down from over 130,000 in August, which at that time was a level that we hadn't seen since the big surge occurred back in January of this year. So from mid-August to mid-November, the 7-day moving average of cases has decreased from 652,000 to 291,000. And in the last week, we find ourselves, however, back up at 350,000. On November 26th, we found that there were 3,122 hospitalizations due to COVID-19. But that is a decrease from hospitalizations about 2 months ago. In Georgia, we're focused on the Omicron subvariant, which represents about 55.7% of the cases here. That would be looking at the subvariant BA5 and also BA4.6. So we are up in cases from a week ago. That brings us to about 4,062 cases here in Georgia. However, hospitalizations are down and deaths are down. So that tells us the work that we're doing is working. We're saving lives. However, we do need to keep in mind that more spread equals more mutations equals more pandemic living. And I'm sure we all want to ensure that we're avoiding that. So we know the Delta variant was believed to be 50% more contagious than the original strain of COVID-19. And now we have the emergence of the new strains, BQ1 and BQ1.1, which have surpassed Delta, accounting for over half of the cases in the United States. These subvariants are believed to be 105% more contagious than the Delta variant, which was 50% contagious than the original strain of COVID-19. So that means an unvaccinated individual's risk of death from these Omicron subvariants is 10 times higher than the risk for vaccinated individuals. So what we know is vaccinations and boosters still work. So as of November 23rd, we had 6,875,947 fully vaccinated individuals living in Georgia. So after sharing this information, we want to take it to our grantees who assisted with their communities with combating COVID-19 in what we now are in, which is the pandemic era, right? Because this has been going on since 2020, so we're now in an era of the pandemic. So our grantees offered 3 versions of small grants. We offered a community small grant through HealthWorks. We also offered a CCB engagement award through HealthWorks and a community partnership grant. So we'll begin with sharing highlights and lowlights from the recipients of these community small grants. We're gonna hand the floor to Dr. Arthur Vaughn of 100 Black Men.
Well, thank you. Thank you for having us. Thank you for allowing the 100 to be part of this wonderful opportunity and this wonderful work that's being done with Georgia CEAL, HealthWorks, and Morehouse School of Medicine. I would like to quickly go through some of the work that's been done. First, the 100 Black Men of North Metro Atlanta is celebrating 30 years this year. We serve Cobb, Gwinnett, and North Fulton counties in Georgia. We have 4 pillars that we focus on: mentoring, education, economic empowerment, and health and wellness. And what we're discussing today is our health and wellness pillar. And we strive to be a beacon of leadership by utilizing our talents to create an environment for children and adults to be motivated and achieve and empower and become self-sufficient and economically and social in the economic and social fabric of the communities. I'd like to really briefly talk about the work we did through this small grant and this wonderful opportunity. So we had multiple events. We started in July, actually. We had a COVID vaccination event up at the Boys and Girls Club in Marietta. We were fortunate through this work and through this grant to be able to offer gift cards to individuals who came and got vaccinated. The center flyer is the flyer from that event. that event was very successful. We were able to not only disseminate information to educate the community around vaccine hesitancy, but also provide vaccinations to the community. Then we moved on to a back to school event, which that flyer is in the upper left-hand corner of the screen, in partnership with the Powder Springs Community Task Force. Again, that event we were able to share educational materials with the community about COVID-19, about, what was it going to be like for the students to be in person for the first time since the pandemic began. And then we also held 2 educational forums. One, again, we were able to partner with HealthWorks Morehouse School of Medicine and Georgia CEAL, as well as Walgreens, to do a back-to-school virtual conversation. That was fairly well attended. We'll talk about our challenges with some of these things in a moment. And we held a second conversation on what long-haul COVID is. So we were able to talk about what are the long-term implications and things and health risks for people who have contracted COVID. And even when the primary virus has worked its course through your body, how does it impact you long-term, your lungs, your other organs, your heart, and other things? And then we held in October our final event through this grant. During a 5K we held in mid-October, we were able to again offer an opportunity to increase awareness and education to the community around COVID-19 and the vaccines. And you can see the large number of partners and sponsors we were able to work with then. We also had an opportunity to work with the Georgia, Gwinnett, and Newton County Board of Health, Walgreens, as I mentioned earlier, and others, WellStar, to spread the word and increase awareness and education. Some of the challenges we've been having virtual conversations on different health topics ever since the pandemic started. Our health and wellness educational series. One of the challenges we had is we feel like people got Zoom fatigue towards the end. So our attendance at our virtual events wasn't as high as we had hoped, but our in-person events were very, very well attended. So one of the lessons we learned through those challenges, we need to be creative in how we reach people. People were interested in being in person again. And after a long day of meetings and other possible Zoom calls related to work, people weren't as apt to want to get on another Zoom call in the evening. So we did have attendance, but we did see our attendance drop from when we started off till we got to the point of doing the back to school event and the long haul COVID event. And then another challenge we had at our 2 largest in-person events, unfortunately, our vaccine partner they had confirmed, but they were notified us that they weren't going to make it, which didn't give us an opportunity to reach out to a partner like a Walgreens or others who could have filled that space. So at our large events in August and October, we were not able to provide vaccinations, but we were able to share information and combat vaccine hesitancy, and also share information about long-haul COVID and other challenges related to it. So even through the challenges, we definitely had some successes. And when we talk about our successes, we had 12 new partnership engagements through this work and through this grant. So we were able to partner with these other groups and expand our reach and expand our ability to educate, which was wonderful. Through our in-person events, we had a significant number of people who showed up. 293 people showed up between our 2 in-person events, which was really great attendance as people were beginning to get back out a bit. There still was some hesitancy about coming to certain in-person events, but people were ready to come back out in an environment that gave us outdoors or an opportunity to spread out a bit. And then I mentioned our educational literature. We created 2 documents, one on vaccine hesitancy and one on long-haul COVID. And we were able to reach just over 800 recipients with our educational literature. So those were some wonderful successes through partnerships, through talking to people at in-person events and also sharing literature, both in person and through electronic means. So overall, it was an outstanding experience that we're very thankful for. And we look forward to continue this work into the future. Now, with that said, I'd like to turn it back over to Ms. Taylor, but thank you again for allowing the 100 Black men of North Metro Atlanta to participate.
Thank you, Dr. Vaughn. That health and wellness pillar has really served you all as well as us at Georgia CEAL and HealthWorks well. We love that recap summary of your successes, but also thank you for sharing the barriers that you experience as we find ways to work to improve that. Next up, we will have Dr. Abu Rayban of Shifa Clinic.
Good afternoon, everyone. I would like to begin with our sincere gratitude and thanking to Community HealthWorks Small Grant Project team, Georgia CEAL team, and Morehouse School of Medicine. Today, I'll be talking about our clinic efforts in responding to COVID crisis. Shifa Clinic is a nonprofit, charitable, free medical clinic that is based on faith, Islamic faith. We operate in several states of the United States. And through our clinics, we reach out to uninsured population to address their healthcare needs. We are treating chronic disease. However, when COVID hits the nation, we responded. We were one of the very first few clinics that immediately back in March 2020, established tele-screening program to identify cases those needed test. In partnership with Department of Public Health and CDC, we identified over 350 cases and referred them to approved labs for testing. That was our early initial efforts to respond to this crisis during the March, April, May, June, initial 4 months of the period of pandemic. Then we started doing COVID testing, working as site for sample collection, and eventually we conducted rapid testing at our clinics. And then as soon as the COVID vaccine was made available after FDA approval, we partnered again with DPH and other organizations and mobilized resources to vaccinate our communities. And then we always recognize that education is on top of every priority we do. So we organized virtual educational seminars, symposiums, and even in the clinic, one-to-one discussion and focus group discussion with our patients. We leveraged our volunteer pool. Across the nation, we have over 1,000 volunteers and 200 doctors. Those were at the front to educate the community about COVID crisis, how to live in this difficult time. We received a grant from the Health Resources and Service Administration, and that $1 million grant helped us building nationwide organizational capacity to address this crisis. During that time, we could train 1/3 of the 200 employees of the organization how to respond to the COVID situation and interact with the community. Being a faith-based organization, we had the access to different religious places. So we could establish connections with the religious leaders, particularly with the masjids, where we presented the situation and tried to help eliminating the misinformation and disinformation about the COVID that were circulating around. That really helped and mobilized the community. We sensitized the community towards vaccination. And our efforts really paid off. In our recent survey, it shows that almost 100% of our patients are vaccinated and 100% of our volunteers are vaccinated. So we did really brought some services to our community that really proved to be effective. And how did we do it? We engaged our big pool of volunteers. We engaged our patients. Once we motivated a patient, then we asked them to motivate others. So using this spiraling effect of the patient population, actually we could intervene the larger community. That's how we mobilized our bigger community, starting from one individual. And then our extra and unique opportunity was connecting with faith leaders. You know, when someone has a crisis, they really rely on their faith leaders. So leveraging that, you know, skill and expertise, we try to train the faith leaders first. So we train them, and this particular project, Community HealthWorks project, helped us to continue those services when we were needing most. We never realized and thought that the problem would last that longer. So we were deciding upon where to stop. And then we found these additional resources. So the small, grant project helped us continuing our efforts and building further capacity. That really helped and motivated our team, our organization, our community. As of today, we have designed and disseminated over 300,000 educational materials in 5 different languages. We have educated over 1 million people and vaccinated a couple of thousand people. So that's really our response to this crisis. We would love to continue these efforts because now we know how to live at this difficult time, how to question the challenging situation, and how to reassurance the community. So these kind of small grants work better, but we also learned that education is not enough to change the practice. So education is backbone of changing the attitude and practice. However, resources are needed to support their other needs. Like during the town hall, we could not make town hall successful without adding other services. So we added up some health screening services, the benefits providing free to the community, some food distribution services along with the educational part. That really proved to be very, very effective. So in any future endeavor,
Dr. Rayhan, thank you so much. This is great information. We're glad to hear about the training and the capacity building that you all have been able to do through HealthWorks along with other opportunities. So now we're going to take a slight pivot and we're going to put a spotlight on our engagement award recipients as well as our community partnership grant. So Mr. Kumar, can you please share how the Andrew J. Young Foundation used the HealthWorks Community Partnership Grant to educate everyone on COVID-19?
Thank you, Ms. Taylor, for having us become a part of this very important and much needed programming. Our foundation's mission is to feed the hungry and heal the sick. And so it naturally falls into the purview of our work globally. When COVID started, we had our efforts diverted to Liberia. And in 2021, we sent oxygen concentrators to India when thousands and thousands of people were dying. At home in Atlanta and in the US, it was more about the messaging. When I was in college, one of the professors told us that, when somebody is convinced in their minds, we can probably talk them through to change their perspective on that. But if people are convinced in their hearts, it's almost impossible to change their perspective. And so the messaging, I think, was very critical because most of the inhibition of not taking the vaccine was because of misinformation. And so we chose the right message from the right messenger. Ambassador Young turned 90 this year, and he has been taking vaccines for all his life, starting when he was probably 6 months old. And so we, with the help of this grant, we came up with 3 PSAs, and we started this messaging, which was very targeted and consistent in August, starting with back to school, then how people were coping with long haul COVID, And how do we prepare for the holidays when families are getting together with their grandparents and grandchildren, and how it is critical that vaccinations are important. And I think that messaging, in today's world, the important part is that kind of digital messaging can reach out to hundreds of thousands or millions of people by push of a button. And that's what I think this grant helped us to do. We received a number of phone calls, and feedback after those PSAs were released. And people were so happy that Ambassador Young is championing this. And as a result, they had got themselves vaccinated. And actually, at one of the events that we organized on his birthdays, we partnered with the Morehouse School of Medicine to set up vaccine site on site to get vaccine tested, and free flow of information about how you can get vaccinated, as well as why. So we are very thankful, Ms. Taylor, for including us in this very important program, and I think it has done a lot of good to people's changing their perspective on why they should be vaccinated and what we can do to stop the spread of COVID in the long term.
Thank you, Mr. Kumar. Great to hear that you've gotten some great feedback from those PSAs. And thank you for also sharing the impact that you all are making internationally through the Andrew J. Young Foundation. So we'll transition over to Dr. Armstrong and GCAP. Dr. Armstrong, please share your successes and anything else you'd like to.
Of course. Thank you, Brittany. And thank you to the Morehouse School of Medicine, Georgia CEAL, and HealthWorks for enabling GCAP's collaborative work in combating COVID-19. Well, we kicked off our award activities with a vaccine event in September in collaboration with the local fraternity, the American Red Cross, and the Ivy Community Foundation. But like the experience of 100 Black men of North Metro Atlanta, challenges with the vaccine provider did not allow vaccines to be administered at that event. However, we were able to utilize that opportunity to distribute COVID-19 educational materials. And as we move into October, a focus was on the promotion of educational resources and partner events. So we were able to promote Georgia CEAL HealthWorks Building COVID-19 Vaccine Competence Summits, and we reached over 3,000 people through our newsletter with that. We also, as we got closer to Halloween, disseminated the What's Scarier Than Halloween and Can Haunt You for Months flyer about long COVID and tips to avoid COVID to youth serving professionals, parents, and youth in our database. And that reached over 1,800 people. But we also were able to provide some in-person support. Later in October, we attended a Crawford County High School event where we disseminated information regarding the importance of COVID-19 vaccinations, boosters, AIDS recipients, and prevention. And as we got into November, just this month behind us, we were able to promote and conduct our COVID-19 Youth Mental Health and Vaccines Town Hall that we partnered with the Boys and Girls Clubs of Georgia and Metro Atlanta to pull that off. But throughout the month of November, GCAP conducted a movie theater campaign in Bibb County, Georgia, that consisted of 30-second video being shown on 16 movie screens prior to the movies themselves. And this video promoted GCAP's Parent Toolkit and its COVID-19 educational resources. There were over 9,000 viewings of this video in the theaters, and that led to 779 visits to our COVID is Still Real educational resource that's a part of our Parent Toolkit website. So, of course, this is a fast-moving award, but there were lessons learned and challenges along the way and many successes. The primary lessons that we learned through this process was that as we have more partners and collaborators around the table with us, we as GCAP either had to provide more time or advocate for more time from lead partners to ensure proper collaboration, execution, and communication. So time is a lesson there. The successes outweigh the challenges here, and that the Engagement Award enabled GCAP to reach about 7,500 individuals we wouldn't have had otherwise. The Engagement Award also drove innovation, like that movie theater campaign I just mentioned, because that was something we'd never done before. And the award also led to the permanent resources, in our Parent Toolkit that we will continue to use as we collectively combat COVID-19 moving forward. So thank you.
Awesome. Thank you for sharing that information, Dr. Armstrong. And we love hearing about your innovation and creativity and the impact you all are making, sharing information on boosting COVID-19 vaccinations. All right, so we are going to pivot back over to our community small grants. We're going to expand our focus right now to outside, including and outside of the Metro Atlanta area. So we're going to start with Ms. Borhe of the Hispanic Health Coalition of Georgia.
Good afternoon, everyone. Thank you so much, Ms. Taylor. And on behalf of the Hispanic Health Coalition of Georgia, I would like to thank HealthWorks, Morehouse School of Medicine, and Georgia CEAL, and all of my colleagues that are present here today from other partnerships, because it truly does take a village to get accomplished what we get accomplished. I am going to share my screen for a brief presentation, and I'm going to speak specifically to our successes of what we have accomplished, and along with some of the challenges. So from the beginning of it, obviously I'm the executive director and vice chairman of the Hispanic Health Coalition of Georgia. We are domiciled throughout the state of Georgia. We have been in existence for over 35 years. Our real call to action from a mission and best in practices is to the Hispanic, Latino, Latinx, and Black Latino populations, and we laser focus on community health promotion, education, policy, and how it affects better health outcomes, and also how it relates to chronic diseases. So when pandemics such as COVID-19 arise, how do we react to the state as a whole to our population that we serve? What this enabled us to do has been paramount for the Hispanic Health Coalition of Georgia. When we looked at COVID and the uprise and the different variants that were coming on, it enabled us to expand our health passports, which assist our community in what needs they have and where we can find needs. We had physicians on site from Emory, from the UGA, from the medical schools, from the dental schools, from the pharmacy schools. We also conducted HPV testing, HIV testing, rapid testing. We have 20 health-trained multilingual promotores on the HHCGA team. So this allowed us to expand throughout the area of not just the Metroplex, but more importantly, we really focused on the rural populations of our Hispanic Latino variant locations and how we could best help them. We also onboarded with Haya Topics, which is a technology where we use with our constituents from board certified clinicians. They can ask questions and answer questions from a perspective of our population in a multilingual perspective so that they have well-vetted information. The success of having dentists, nutritionists, and all of the crossovers significantly helped us, not just to chronic diseases, but also how that impacts COVID and how all comorbidities impact COVID. So for this grant, we can not say anything more, but thank you so much for extending our trajectory. Our challenges are the challenges that we have as a population: information dissemination, education, language barriers, culture barriers. Transportation is very large, and obviously technology deficit is, as it is in most rural populations and other races and cultures. So we really focused on education, how we can bring education. All of our sites had vaccinations on them. We also had all of the testing and the other chronic diseases, which significantly assisted us in our town halls, because we also focused on mental health, addiction, and how that impacts people of all ages, from children to above. So that is where the psychologists, the neuropsychologists that teamed with us, we had probably onboarded at least 18 partners through this short period of time, through this wonderful opportunity provided to us. Our Feria de Salud, or our health fairs, reach such a large number of our community throughout the state. It allows us to provide health and social support and resources. So it's very, very multi-pronged. And we've always been known as an agency that can be trusted by our population. But one of the largest successes that this opportunity brought to us is others that are outstanding partners that our population may not know, because they were able to onboard and go into the population with us on a regular basis, that provided them with greater trajectory. We basically hit the north, the metro, the south, east, west as we through this opportunity. Pocket Help is our neuroscientist and neuropsychology team. We've worked with the Colombian consulate. La Vaquita is located in Jefferson, going towards, it's Pendergrass going towards UGA. Dalton Housing Authority. And why these locations were very important is La Vaquita on a Saturday and Sunday generate 35,000 individuals from the Hispanic Latino population. So it provides us a large arena for education, for testing. I believe that we had 14 COVID-19 at home tests that we, during this time period, distributed in those areas, along with vaccinations. So this just provides kind of the range of all the places that we've been. Healing Bridge Clinic, we onboarded with some of Morehouse, Emory, UGA, Georgia Peach, and the physicians literally conducted wellness checks while we were also providing vaccinations. So it allowed us to utilize all things that affect all of our minority populations throughout the state so that we can have better health outcomes. Our social media strategy allowed us, because we are multilingual, most of our team is multilingual, it allowed us to get to the communities that other individuals could not get to because of the linguistic capabilities and the service gaps that are natural to a lot of underserved populations. That strategy through this opportunity was expanded and helped us significantly. Our team works collectively for the betterment of whole, and what I can say was one of the greatest challenges is always finding partners that can help you there. So although that continues to be a challenge, this helped us overcome part of it, but it remains a challenge for everyone.
So we're now going to pivot and spotlight again some more of our engagement award recipients. Going to take it down to Dr. Mack. Dr. Mack, can you please share your successes and the activities that you were able to offer through the HealthWorks opportunity?
Thank you, Ms. Taylor. On behalf of the Fellowship Missionary Baptist Convention, I'm very pleased, proud, and privileged to have been afforded the opportunity to partner with Georgia CEAL, Morehouse School of Medicine, and certainly HealthWorks. The collaborations have been very fruitful, and I also believe have been rewarding to the folks that we've been able to serve. Georgia CEAL, Morehouse School of Medicine, along with HealthWorks, have helped our convention fulfill our mission. And our mission is to evangelize sinners and equip the saints. And being able to bring this kind of information during this serious time and crisis of our world, this global pandemic, is certainly rewarding to us to know that there are partners out there that we can connect with and make some positive things happen. We were able to target areas that encompass Middle Georgia and South Georgia, which is a pretty broad range. But it was perfect for us because we had churches in both Middle Georgia and South Georgia. We were able to set up our strategy to extend the partnership to two of our local Baptist associations. They both have their own numbers of registered churches, and those churches then became a part of the collaboration with us. Both association meets once a year annually, and my team and I was able to go to both annual sessions and offer information, literature as it relates to COVID-19 and all of the things that entailed during this pandemic. We were received warmly, and our mission for going in with this information was to certainly assist Georgia CEAL, Morehouse School of Medicine, and HealthWorks in dispelling so many of the many myths that is out there. And we believe that we were able to do that, and we continue to carry that fight. When we talk about those two associations, when we combine the makeup of churches, we're probably looking at about 168 churches. And again, that means our scope was quite broad. As we zoned in on some of the more specific services that we were trying to render, we were able to organize 3 vaccination sites, one in August, one in September, and one in October. We were able also, in conjunction with that, to circulate educational literature via emails. And at these association events, we were able to have people on the ground passing out the physical literature as well as interacting with individuals as it relates to their questions, their concerns, and even listening to their comments sometimes as it relates to the COVID-19 pandemic. Last but not least, we were able to sponsor one webinar. Our subject was long COVID and its effects on the community. It's kind of like what Jesus' mother said at the wedding at Cana of Galilee when the water ran out. She said, "We saved the best for last." And I really do believe that this webinar was last, but it was very good. That the numbers, and I'll get with that, I guess, when I start talking about, let's say, the lows of our partnership. But we were able to build a dynamite, out of sight panelists made up of medical professionals out of some of our churches in our convention, 2 doctors and a physician assistant. They were well-versed. They were engaging. They brought the enthusiasm. And from that, it stirred all of the participants of the webinar to stay in the chat room, asking all of the questions, the broad questions, the more defined questions. And even though the numbers, again, did not reach what we desired as our goal, but we feel and know that needs were met. And we were very pleased about that. Our panelists, I would pretty much put them up against any panelist anywhere. Again, well-versed, enthusiastic. When we got to the Q&A part, that alone would have been a capstone on the particular event. And we want to say thanks to Georgia CEAL, HealthWorks, as well as Morehouse School of Medicine for considering the Fellowship Missionary Baptist Convention. One last thing on the positive side, Georgia CEAL and HealthWorks combined has an out-of-sight staff and team. I would call it rated as a 5-star team. They always returned calls. They always responded to our email. They always gave us great directives when we were moving away from the beaten path. They really, really were supportive, and we have enjoyed as well as embraced the partnership with these groups. For the
Thank you so much, Dr. Mack. Thank you so much. You've done a great job, and that town hall did definitely have a dynamic panel. You're exactly right. So we're going to go on over to Mr. Oludare with a Georgia Arrhythmia Consultants and Research Institute, share a little bit more about another happening down there in Macon, Georgia.
Thank you, Brittany, and thank you to Dr. Kintobi and Georgia CEAL and HealthWorks for giving us this grant to be able to work in our community. We actually started working with Georgia CEAL last year when we got an initial grant, and we used that as an opportunity to speak to some of the churches in our community. We were able to do a lot of education about COVID and COVID safety, especially in teaching the community as to how to return to in-person events and how to take proper precautions on when to do that and how to be able to safely do those if organizations were willing to start doing those. We were able to reach about 10 churches and talk to over 100 people. Earlier this year, we also had an event at a church where we did another education meeting, and we used that as an opportunity so what we do at GAC is we also do a lot of clinical research, and we use that as an opportunity to speak to the community about how participating in clinical research, particularly we're working on one with UMass about COVID testing, and we're able to educate the community as to why it is important to participate in this research so we have data that can help us understand how to develop better diagnostics, and we were able to get really good feedback from the community and also educate them as to the importance of research. With the HealthWorks grant that we got this year, we had 2 events that we hosted. One was a combined health fair / town hall / vaccination event. It was a bit of a handful, but it went pretty well. We had our physicians talk to it was held at a church, and we had our physicians as well as some of our staff members talk to the community as to the importance of vaccination, the importance of safety, of masking, and also distancing in the community. We also gave out gave a lot of vaccines out, and also scheduled some people for boosters, as well as also disseminated materials about COVID and COVID safety. And our final event was in November, and it was at our organization. So our clinic also has a foundation, and with the combination of that foundation, we're able to host a 5K every year. So as part of that event, it was primarily an education event, and thanks to CEAL, we were able to have some educational materials, which we were able to disseminate to the public. And those were our real big successes with CEAL. The few, challenges that we had and issues that we didn't really think to address that we're going to address moving forward is that the demographics that we reached were mostly older adults, which is good because we know that COVID has more of an effect on that population, but we want to be able to reach younger populations and be able to get our message out to them, and also get them more informed about COVID and boosters. So moving forward, we plan on targeting the universities that we have relationships with, and being able to talk to those groups of people, as well as leveraging our social media and using that as a way to reach the younger audiences. So that's what we did at GACRI. Thank you very much, CEAL, for working with us, and it was a pleasure working with you too, and we look forward to future collaboration.
Great. Thank you so much, Mr. Olidere. And that importance around clinical trial enrollment is really helpful and essential to representation across the communities we serve. So to bring it on home, we are going to transition to Mr. Sobbs down in Albany, Georgia. Mr. Sobbs, looking forward to hearing what you all are doing in the community.
Okay, well, thank you so much, Brittany. And I'm going to ask you to take this tour bus down 75 to Albany, Georgia. Not Albany, this is important, Albany, Georgia. And actually, guys, it's been an honor to serve with all of you on this project, especially with the Morehouse School of Medicine, whom I've been with for so many years. And I'm especially excited about the fact that so many men are involved with this initiative, because often through my years of experience, nothing to do with the women, but mostly I see a lot of women in the engagement and outreach work, especially around healthcare. So I'm so proud that men are involved, and your outreach went to the kind of places where I know we needed to insert this messaging. So, of course, Albany was called the epicenter of the breakout for the state. It kind of started there, guys. I don't know if you know that, but there was a funeral in Albany, Georgia, and a person came to that funeral and was sick. Nobody knew what COVID was. We definitely didn't know in the hospital health system what it was. And so we released the person, and they went back to Atlanta, and that's how it kind of spread from that area. So that funeral kind of broke out pretty big here in the area, and it really did spread up there. In the rural landscape, guys, this is what I think is important about how you helped us. In a rural landscape where poverty and social determinants are such a challenge, access to care and income equality are big issues in these kinds of communities. So faith, as my pastor talks about, hope and cooperation and resilience are key to community successes. We worked in 6 counties in our area down here, and we reached over 1,000 people with education, a couple of hundred people that we reached with screening. And what I found out, and I'm hearing a common denominator amongst all of us about how important partnerships are. Trust, as we all know, trust
is a motivating factor for impact. The pastor said that so well, and all of you said that we know when people trust you and people can believe in you, then people will work with you. And in rural communities where resources are very scarce, I mean, we're used to not fighting over crumbs, but we don't get the pie, but we do get the crumbs here. And we learned that we have to lean on each other. We have to have a sharing attitude with one another in the rural part of the state. And in that way, we're able to maximize from our unity on the impact of the work that we do. And so partnerships was everything. Georgia CEAL allowed us to work together outside of our silos, but in partnerships with one another. And it brought out the best in us. Let me tell you who our partners were. Albany State University, the HBCU here in the community, our public health district, which does a lot in our area when it comes to education and COVID. The United Way and its whole umbrella of community-based organizations, the hospital, the health system came in strong, and also barbershops, guys, and beauty shops. Those places of trust came in, and the church came in, and also family connections. Now, all of these agencies normally work in their own silos, and everybody had a task of doing something. But what they didn't do was connect and network and partner together. And the CEAL grant gave us that opportunity to bring everyone to the table and the wares to the table. And so we did everything virtual. We did everything in person. I'm sorry, nothing was virtual. And so the challenges weren't quite what you would think they would be, because again, it hit us so early. You know, we saw death, we saw dying, we saw despair, we saw families confused and frustrated, funerals every other day. I mean, we were so glad to climb out of that, because not only did it scare the heck out of everybody, but it also gave us, those of us who are outreach workers, opportunity. Because people saw so much devastation that everybody said, hands on deck, with what do we need to do to get out of this situation? And so everybody did what they did, and they did it well, but nobody was able to bring them all together and bring that united focus of strength. And that's what the CEAL grant, Georgia CEAL grant, allowed us to do. It allowed me to direct that network of golden partners together, so that when we did show up, we showed up strong. I had health screens there. I had barbers there. I had the United Way there doing their thing. Public health was there. My hospital provided opportunities to do the COVID shot, so I didn't have to call in anybody else to be the provider. So the convenience of what we did have in our individual resources, when it came together, it just gave us such a powerful opportunity. And so I thank Georgia CEAL for making that possible. Now, I don't know if I'll ever get the mic again, but just let me say, make sure you vote, make sure you vote early. And I want to say that democracy is a spiritual idea, and your vote is a prayer.
Oh, thank you very much, Mr. Sops. Great to hear that you were able to make connections through the HealthWorks small grants that you received. And thank you for encouraging us to continue doing such in our communities, and also to go out and vote. So we are going to take one more slight pivot. I'm going to take some time to highlight the overarching successes and barriers that were experienced through these HealthWorks small grants. So again, I'll say that we are now in a pandemic area, and there are threats of us approaching a triple-demic, which we know is an occurrence of RSV, flu, and COVID-19, which means that the work is not finished, and we still need to continue with our efforts. Before, however, I delve into this nice recap and overview, I do want to take the time to acknowledge our team So in addition to me, the HealthWorks team has Dr. Tavia Akintobi, as well as Ms. Kamaria Glover, who serves as our HealthWorks community health worker. And then we also have Ms. Chanel Harris, who serves as our HealthWorks research associate. The success that you all have expressed would not have been achievable without their assistance. And so we just want to make sure that they are recognized. So I'm going to take this time to share a quick overview on our lessons learned. So as a part of the grantees, we were asking them to complete some monthly reporting, and we pulled from these monthly reports the successes that our community small grant recipients highlighted. So here you will see, in addition to what was stated, some of the successes that were experienced as a result of these community small grants via Georgia CEAL and HealthWorks. So hosting successful webinars, forums, vaccination events, expanding partnership reach and incorporation, and having that in-person reach and touch. We also asked about barriers, as we know that is important towards informing progress. Vaccination events were indeed a barrier across some of the grantees. Some of that was due to the change in vaccination availability. And so when the U.S. Medical Administration notified the vaccine administrators that there was no longer approval to administer the previous COVID-19 vaccination and boosters, it left us without the ability to provide vaccinations at events that were confirmed. And so that did both impact our grantees and us as a Georgia CEAL team at large. But we do want to highlight the key takeaway, which is what we were here to offer these community small grants for. So we asked our small grant recipients, did they feel more comfortable and confident about sharing COVID-19 information and hosting COVID-19 related events, be it education events or vaccination events? And you'll see here what those results were. So we did not, thankfully, have a decrease in confidence between the midpoint and endpoint. We were able to maintain their levels of confidence and comfort in offering these events and services. So we had a 75% return rate on an increase, them experiencing an increase in confidence and comfort, and then 25% stated there was no change from the beginning of receiving the grant to the end. And then cumulatively, here is our impact statement as everything that fell under the HealthWorks bracket across all of our grantees. So we were able to effectively develop 44 materials. That includes flyers as well as educational materials that were handed out at our community events. In total, 9 COVID-19 education forums were hosted, and that is between July and still ongoing at this time. We've hosted 22 vaccination events, distributed over 6,000 resources, hosted over 23 vaccination events. And then you did learn about those 3 COVID-19 and long COVID PSAs, reaching over 4,500 people in total through all of our efforts as a part of this small grants through HealthWorks. And here we've also highlighted some of the challenged. So we understand that community-based organizations have experienced some delays with invoicing and payments, and we at Georgia CEAL are working to try to improve that. And we're trying to provide as much assistance and information around that as possible. We experienced some data collection limitations, and that also alludes to the vaccination events that we also experienced limitations with. In trying to partner with commercial pharmacies, there's a bit of hesitancy due to lack of reimbursement rates. And then staff shortages and changes in staff also played a part. So in looking at all of this, we will now open up the floor for questions for our HealthWorks grantees or questions from our HealthWorks grantees to one another. This forum, this convening was called and pulled together as the request of Dr. Rayhan. And he thought it was a great idea for us to be able to come together collectively as a group and learn from one another. So we're going to open up the floor for you all to do that. Dr. Rayhan.
Thanks, Mr. Taylor. This has been a momentum that we build, and we learned that the problem is not stopped yet. We have to continue our work to strengthen the already built community resilience against COVID. Once we build this momentum, how you foresee to continue?
Sure. So part of this, these grants were to provide you with more of a launching pad to building the community resilience in your communities. Some of you all have started that on your own prior to these small grants, and some of you all were boosted from these small grants. Georgia CEAL will continue to offer opportunities for the community to provide COVID-19 vaccination events, COVID-19 education events. We are still attempting to educate everyone on long COVID, as that is also something that's fairly new, and we're still all learning collectively about that. Additionally, we do send out resources that connect you to other funding opportunities that will enable you to continue this work on a larger scale if you choose to do so. So you can continue to look to Georgia CEAL to offer additional opportunities, as well as information and resources on things you can use to elevate what you're doing in your communities. So that brings us to one question that we have at Georgia CEAL for you all as panelists. What are some recommendations for things that you believe Georgia CEAL can do as a network to help elevate and promote these types of activities in the community, since we know we are not done with COVID-19 or long COVID, and now there's mpox. So please do share.
Thank you. I believe that one of the things that we would be fortunate to have done is that Georgia CEAL will continue to bond a relationship with all of the different collaborations that have already been started, and that we will continue to spread our wings to others that did not participate with us in collaborating, and continue to try to sell what we know has worked and become better at what we know that has worked.
Awesome. Thank you, Dr. Mack. I'll take it over to Ms. Borghi.
I echo what Dr. Mack said, and I think that there also could be a more formal way to engage on the front end with partners. From CEAL is a very large family. So if we had a more formal from the forefront before events are planned and say, hey, do you want to come with us on this journey? Or Dr. Mack says that, or Mr. Saab says that, so forth and so on. Since we're all spreading throughout the state, that gives us, again, better trajectory. But if we could find a mechanism to do that in the forefront, I think that would be really helpful.
Absolutely.
Sure. That is definitely something for us to consider as well. In addition to considering that, we do get a lot of requests from the community for assistance for events but it was very short notice. And so under those circumstances, it would be a bit difficult to be able to connect you all and pull you in, because you all are very active and involved in your own communities.
Absolutely.
Yes, Dr. Mack. And so that presents a little bit of a challenge, but that is definitely something that we can explore, a means of creating some type of form of communication for you all.
And Brittany, also, when we put together the webinar, I have to admit, I was amazed at the resources that we already had. I just really didn't know that, but because I knew that we needed to do a webinar and I selected that subject, then I started to check to see what kind of resources we had. And it was all there all the time, but just didn't know. So really, the arms and the limbs are far reaching. And with all of us as partners, we can cover the vast state of Georgia and it not be too cumbersome.
Absolutely. Thank you for that addition, Dr. Mack. Anyone else want to share?
Brittany, I would just say that to continue to convene and call, not everyone may show up, but no one's going to show up if no one's calling us together. So I would say continue to convene.
Absolutely.
That's a very great point, Dr. Armstrong.
Even though I want to take a break for a second or two here, just to kind of reload, but trust me, it is all worth it.
Thank you. So we did receive a comment from the audience stating that this has been very insightful, and it's showing that we do need to continue our collaborations across communities in order to keep our communities healthy, alive, and well. And I believe all of us here on this panel can agree with that.
So, Brittany, may I ask a question that maybe the other panelists could help me with?
Sure.
So we found that, and I'm going to put this as plainly as I can, that increasingly people wanted to discuss COVID less.
Yes.
So how are you all able to continue to engage people in a conversation that it feels like they don't want to have?
Brittany, this is Ms. Borghi. May I respond to Dr. Vaughn?
Sure.
Dr. Vaughn, I can tell you that was definitively became a story, right? Everyone's like, please speak to me about anything but this. So that was why we engaged to comorbidities and chronic diseases, because that's also a byproduct of the pandemic, right? And we're at some point we'll have another pandemic. So by onboarding other services that could be leaders, and so it wouldn't be a lost lead or you wouldn't lose opportunity. We found engaging people with diabetes checks, or individuals with HPV screening, or individuals with something. That's why we're the dentist, right? So are you good with your dental care? Musculoskeletal. Those were all nutritionists. Those were all done in a very mission-driven manner, so that we didn't lose the pace and that we didn't get the, please don't make me speak about this again today. It was a burnout.
Yes. Yes.
I totally agree with that, Bella. She's spot on. We found out we couldn't lead with COVID all the time. We just couldn't lead with it. I mean, maybe I had to lead with a free haircut and come and get your COVID shot, or lead with just another food giveaway and come and get your COVID shot with it, So, and you were absolutely right. And health screens, I mean, there are other products, and as Bella said, there's that comorbidity, and there's that leading to that people are relating to, the diabetes, the high blood pressure, and things that they're going through. And if that's there also, then it feels like a more pleasant invitation.
Also, Brittany, picked up when you said that we're headed or are in a triple demic. So that's a new way of still staying connected. I thought that my pastorate was going to be challenged because we use our email data bank to send out the literature, the written literature on the COVID. And I had people started hitting the unsubscribe button because they just didn't want it. But using those other alternatives is certainly spot on.
You know, one of the things I was pleasantly surprised about was how, you know, the production of all of us and what we did and how we launched the activities that we were doing, because there was a mixture of skill base needed to do this. You had to know how to do some strategic planning in your community. And you had to know how to do outreach. You had to know how to do some marketing even. And I didn't think that everybody would probably get those skill sets, but those of us who've been doing this work for some years, we knew. And then I think Georgia CEAL was very helpful, particularly in the marketing part, you know. None of us had designed flyers before. You know, none of us had really maybe done the kind of canvassing that was important or messaging that was important. And so, you know, I watched everybody come to the table and looked at everybody else's successes. Now, I don't know what Georgia CEAL had to go through to get us all there, but I was really pleasantly surprised at the professional production that I saw for each event. And it's obvious because we're seeing it right now. So it didn't seem to be much of a challenge, unless I'm speaking out of term of other people. But I thought that was very good for us to be able to take those specific skills or duties of marketing, outreach, if it was canvassing, and strategic planning, you know, unless they knew so much to pick the right groups. I don't know, but it was good.
Thank you all. Thank you so much for that. Well, we did receive another question from the audience, so I do want to make sure we take time to answer this question. So this is from Mr. Wayne Glathian. I'm not sure if I'm pronouncing that last name correctly, but his question for you all is, how can we further assist expanding the message and opportunity to reach more in our communities? And he's hailing from Atlanta, but this is for all communities.
Well, I think partnerships, right? We every time we do something with another group, we expand the number of people we touch. Right. So as many collaborations as we can find with like-minded groups to touch people, to educate, to you know, break down barriers. Bella mentioned it more than one occasion, and I wish we had done more of this. Putting things in multiple languages is great, but those collaborations with groups in your area or throughout the state are critically important, and from my perspective.
The multiple language is important, and also the multiple channel, and then the multiple issues should also need to be addressed. So this group should think about not limiting within COVID. I know the Georgia CEAL has the mandate to talk about and deal with COVID, but we should be recognizing the silent pandemic that is diabetes. You know, so we should come across with some new messages about the other problem that needs to be addressed. And often we don't recognize those silent pandemic. So we need to continue this resilience that we build with new messages, new approaches to new communities.
And I think there's also definitive strength. So we represent many different cultures and races in this group and different geographical areas. And language also goes to trust. Right? I come from the population that we serve. There's something in that I'm identifiable. That is like most races and ethnicities. And leveraging that as a whole, I think is very, very productive. I spoke briefly about that we invited partners who may not have been comfortable, obviously because cultural, linguistic, so forth and so on. And that's not a non-determinant to me. We have translators on our team with promotors. So to briefly say, everyone here in these partnerships, and to answer the question also that the other individuals asking from the forum, is that's really looking at best in practices. How do you leverage the strengths of your partners what is needed, where is it needed, and how can you best leverage and mobilize where it is and whom is a participant.
Absolutely. And another component of that is us as the host network. So us as Georgia CEAL taking this information back and relaying it to those funding organizations. I've been as vocal as I could as a part of Georgia CEAL, as have the rest of our leads across this effort. And in addition to the HealthWorks Consortium, relaying this message up to HRSA, who has funded HealthWorks, and I myself with NIH, who funds CEAL. So one thing, speaking to the availability of resources in several languages, is that we unfortunately did not receive the data collection form in several languages. We received that form only in English. And so the question was presented, what are we going to do for our Spanish speaking populations? We haven't received that information in that format. And we were told the question was asked, and that they were working on providing it in Spanish, but we are awaiting that and hopeful that it is also provided in additional languages, because there are multiple languages spoken across the nation, and these opportunities are offered in multiple states.
And across this state, and I just utilized Spanish because that's our forte, but there are so many languages that are within this state that if you cannot communicate, then you can't communicate. So then you cannot be effective.
Mm-hmm. Absolutely. Absolutely. Okay, so this has been a great convening. You all, as panelists, have provided some great insights. We enjoyed hearing your experiences, your lessons learned, and then we brought it on home, highlighting some best practices across each of your respective organizations and communities. So I want to thank you all again. I want to extend a big thank you to Georgia CEAL, HealthWorks, Alive and in Color, and the Black Cross for producing this great lessons learned convening. And we will be in touch with you all with more opportunities in the future. Everyone have a great day.
Thank you. Enjoyed it.
Thank you.
Stay well.
You all too. Bye-bye.